that will be on our website. And if you are not familiar with the Institute for Women's Policy Research, I'd like you to please go to our website, iwpr.org, and then click on Donate Now. But quite seriously, you will find a great deal of information and resources there. And for those of you who are a little bit further from the screen, there's an open table here with 5 seats. There's quite a few seats down at this end, and you will get a better view of the PowerPoint. And we really invite you to move if you would like to. To just give you a brief overview, for 30 years, we have been bringing together academic researchers, policymakers, advocates, practitioners, and neighborhood providers, business, labor, and other stakeholders. And all of these groups are represented in this room today. We are also particularly appreciative and proud to be in the House of Labor. You can see the beautiful artwork. I know some of you have not been in this building before, and we thank our board members, Liz Schuler and Loretta Johnson, from the labor movement for their support. Now, I'm very pleased to tell you about Morgan Higgins. She is from the JPMorgan Chase and Company. She's here representing the funder of this research, the JPMorgan Chase Foundation. She is the executive director of middle market banking at JPMC in our metro area. I believe that is also Middle Earth banking. Like all of us, we have found we are always working and worrying about family care every day. Every time we at IWPR meet with JPMC leaders in the group Women on the Move, we are energized. Please welcome Morgan Higgins.
Good morning. I'm Morgan Higgins, an Executive Director of Middle Market Banking for Washington, D.C., and thanks, Heidi, for those kind remarks. By serving clients ranging from small businesses just getting their start to our nation's largest employers, we certainly understand at JPMorgan Chase that jobs and the opportunity to work are the foundation of our economic and society. That's why at JPMorgan Chase, we believe that more people should have access to opportunity and the chance to move up the economic ladder. As a foundation, our model for impact includes a data-driven strategic focus on what we have identified as 4 key drivers of inclusive growth. Arm people with the skills needed for today's high-quality jobs, provide small businesses, particularly minority-owned and community-based ones, with capital and resources, invest in community development that revitalizes not only urban cores but also surrounding neighborhoods, and give households the tools and resources to manage their financial health. Over the past decade, JPMorgan Chase has more than doubled its annual philanthropic giving, reaching approximately $250 million in 2017. Additionally, we have also dramatically increased our support with human capital, collaboration, data, and management expertise. Around the world, we are putting our model for impact into action. In collaboration with deeply committed partners through a series of strategic initiatives, all are informed by data and are focused on strengthening the underlying systems needed to deliver sustainable change. From our investment in workforce development programs globally, we understand that one of the best ways an individual can achieve a prosperous and stable future is by securing a good job in a growing industry. Data and analysis by organizations like the Institute for Women's Policy Research are essential for identifying solutions that address the misalignment between the skills employers need to be competitive, the skills available in the workforce, and the opportunities available to different types of individuals. The work and the skills needed are changing, and all of us need to try to get ahead of those changes. Elder care is a rapidly growing occupation, and I am pleased to see it as the focus of today's discussion. Now it is my pleasure to introduce Ariane Hegewisch, Program Director of Employment and Earnings at Institute for Women's Policy Research. In this role, Ariane has been directing the analysis on these shifting trends all across the economy and helping to equip founders like the JPMorgan Chase Foundation, employers, and community organizations with critical information about the future of work. Please welcome Ariane.
Thank you very much, Morgan, for that introduction, and Thank you for the foundation for allowing us to work on this important topic of women and the future of work. As Heidi said, at IWPR, we're concerned about women's economic security and understanding what shapes the future and hopefully contributing to how it is shaped. The discussion on automation and artificial intelligence, maybe just me, but it sometimes can just feel a touch male. It's all about driverless cars, about Uber driver, about factories built where cars are built by robots. Don't know what it is all about cars. Maybe because women's manufacturing jobs were actually automated or exported away first. But so we were hoping, and we're very grateful for this opportunity to get a handle on what automation and artificial intelligence means or can mean for women and men and our joint future. So since we started this project, which hasn't been very long, just at the end of last year, there has been a new study on automation, projecting job losses, job gains, job changes, almost every other day. When we started, women really, there was very little about women in those headlines. Now there's more, probably something else to thank Me Too for, that there's more balanced attention. But let me say what I want to do or what we are hoping to do with our project. So firstly, we want to focus on the areas where women are most likely to work or where they're concentrated now. If you think about the US economy, one of the most prominent feature is occupational segregation, that something like 40% of women and slightly more men work in occupations where there are the majority of the workforce, right? So in a way, you need to look at those impacts separately. And we want to look at factors both in terms of the quantity and the quality of work. The second issue is to identify both the threats and opportunities for different groups of women, to take an intersectional lens, and also for women compared to men. We also want to include the impact on work and family, because apart from working in different occupations, women are, of course, also much more likely to be engaged in unpaid care work. And technology there can offer opportunities through teleworking, through driverless cars maybe through Uber driving. It also poses threats in terms of how you can organize work, scheduling, and so on. And it may come to a more equal future. It may reinforce existing gender inequalities. And finally, of course, we're hoping to at least put our fingers in the direction of some policy solutions. Okay, my role is just to very quickly run through the general data on what we know about the future, or what people are saying about the future of work. Don't know how much we know about it. And I'm not going to talk about care at all. That's going to be Jerry and Sarita after me. By now, you may all have come across this study by two Oxford researchers who basically took technological potential and assembled a panel of experts, and they reviewed lots and lots of job descriptions, and from that developed a kind of, they ranked all occupations by the likelihood that they may be fully automated within the next 10 to 20 years. And they came up, and they used US data, they came up with the finding that 47% of all US jobs could be automated within 10 to 15 years. That was in 2013, and that threw the cat among the pigeons, you can imagine. We replicated that to see how this would affect women and men separately. On their methodology now, women hold 46.7% of the jobs that are threatened or would be threatened, which is almost exactly their share of the labor force. And you can also see all groups of women would be impacted, but Hispanic women are particularly likely to be in jobs that could be automated technically. Now, of course, sorry, I should have put that at the top. Having such a big study caused a lot of reaction. And I think the other most important innovation on the studies is McKinsey, who are saying two things. Firstly, yes, you can automate parts of jobs or replace them with computers, whatever, but really jobs have lots of tasks, and in most jobs, there's only some tasks that could be replaced by technologies. Others might be complemented, or other jobs may not be impacted at all. So they try to have a more balanced assessment. And they also try to take into account different scenarios of new jobs, a new demand for jobs that may be created. So what they are saying that in 60% of occupations, so a large number of occupations, 30% of tasks can be automated. And if you look at the occupations that they highlight, that it's harder to translate that into kind of just X% male, female. But they are saying it's particularly middle-skilled jobs that involve routine knowledge work. So if you think about it, those are a lot of jobs where women now can still make a decent living. Office jobs, medical secretaries, all those kind of jobs may be highly at risk. They also develop scenarios saying, you know, it depends how quickly technology is implemented, and you need to take, you know, into account the policy context and what happens to wages and to minimum wage and to wage growth and to occupation and training. But overall, it's still a dramatic impact. And what they are estimating is that between, it's about over a quarter to half of all jobs will be displaced by 2030, meaning that they need substantial change, retraining, kind of reinvent what they're doing or how work is done. Okay, that's McKinsey. Now, again at the bottom, let's look at what the Bureau of Labor Statistics predicts. Their prediction just goes to 26, but that's not that far from 2030. They suggest that there actually will be a job growth by 7%. So from minus 47% to plus 7%. Which, and there, if you hold occupations constant, who does which jobs now, you know, so don't change the gender distribution in jobs, then women will hold 49% of the jobs that will be there in 2026. So a slightly disproportional job growth for women, but, you know, in a way, no dramatic change in numbers of jobs. Of course, the Bureau of Labor Statistics does not include hours in those projections, and we know that hours of work seem to have fallen, and maybe in some occupations more than others, so there may already be some change. But overall, there's a dramatic difference in those projections. So, you know, just, you know, as a conceptual issue, there clearly is the technical potential for change, but that then gets translated in the economics incentives. A lot of those are wage rates, but also, of course, the scope for new jobs to grow. And there's also the social acceptability of automation. If you think about the biggest problem for driverless cars at the moment, it's not technology, it's social acceptability. Now, what does all this mean at this stage? You know, I feel sometimes we're saying, okay, the BLS, you know, there's so much cry wolf that nobody listens anymore. But technological change seems to be coming pretty sure. We just don't know how quickly, and there's a high level of uncertainty. The second issue, though, is it's not just about the quantity of jobs, but about the quality. and the potential of technology both to make jobs better and possibly worse. And of course, demographic change creates a lot of factors which will influence how we work. As climate change, technology isn't the only issue impacting what will happen to us in the future. Finally, it's very clear, or not quite finally, that women are underrepresented in the jobs that design and invent the technologies, and hence we may be left out of that very important part of shaping the future. And that's the final point. Policy matters a lot. And now, for the real meat of this talk, over to Heidi and Jerry.
Thank you very much, Ariane. That was such an excellent overview. I'd now like to introduce my longtime friend, Jerry Jacobs, a sociologist from the University of Pennsylvania. He's been on the faculty there almost as long as I've been at IWPR. He has a PhD in sociology from Harvard. He's the former editor of the American Sociological Review, and he's the founding president of the Work and Family Researchers Network. He has published extensively on gender segregation in work, on women's careers, and on work and family, and his current focus is on how technology is changing work around the country and the world. Welcome, Professor Jacobs.
Let me see. It's a pleasure to be here. Thank you, Heidi. I don't know if Heidi remembers, she was the commentator on one of the first papers I presented at the American Sociological Association. And I hope I've improved over the years. Let me see if I can get this to work. So, quick thank you. I've been working with a graduate student named Tina Wu, who unfortunately can't be here today because she's presenting at the LIRA conference in Baltimore. IWPR, thank you for inviting me. And I've also gotten some support for this project from the MAC Institute for Innovation Management at the Wharton School at the University of Pennsylvania. So to echo a couple of the points that Ariane made really quickly, the idea that the robots are going to come and take our jobs has percolated into the public consciousness. So this cartoon kind of gets at this idea that you go to the unemployment office and there's a robot there. Maybe worse is the idea that the robots feel like they're going to be put out of jobs because some other robot is going to take over for them. The headlines that pinpoint the number of job losses, I think, are responsible for this. So when Frey and Osborne, as Ariane mentioned, say 47% of jobs are going to be eliminated, first of all, that's absurdly specific, okay? 47% really? Does anybody really know that? Second of all, if you're a headline writer, how can you resist that headline? Every day, every week, every month, there are new statistics to tell us how many jobs are going to be lost. And so I think it's really come to dominate our understanding of this. I've got a couple of slides here, and you're going to be wondering, what is he talking about? The British are coming. Am I in the right place? Is he suffering from early onset of something or other? So I'm not talking about the British coming to shoot us up. I'm not talking about the next royal wedding. I'm not talking about the next Beatles tribute band. But in fact, there was a report just this week saying that 1/3 of healthcare tasks can be replaced by robots, okay? What's interesting about this report, and again, I don't want to spend a lot of time on this, I want to get into eldercare. I'm going to do that in just a second. What's interesting about this is that it's being put forward by somebody on the left who wants to save the National Health Service in England. And the idea is that the way to save it is by cutting costs, by introducing technology that can save money and that can really revitalize the healthcare, public healthcare system there. I'd love to talk with you more about this in the discussion. I think this is fundamentally wrong. I don't think 1/3 of jobs are going to go away in healthcare. As a result of this bombardment by these statistics about job loss, the public has come to accept the idea that automation is coming. Automation is inevitable. Automation or robots or whatever, technological change are going to lead to higher unemployment. There's one caveat, which is almost as high numbers say, but it's not going to affect my job. Okay, so everybody believes that the technological future is already happening and is not something that we can do anything about. And one of my main messages, and again to echo what Ariane pointed out, was that there are lots of choices that can be made, not only which technologies, but how they're implemented and whether they're going to complement the work that people do or whether they're going to replace people. Maybe more important than the public acceptance of the inevitability of technology is the idea that business leaders seem to have embraced this on the grounds that computers and technology and robots are less likely to make mistakes, produce the work faster, produce higher quality products, and they think that this can all be easily implemented. Again, I think this is overly optimistic and not realistic, but nonetheless, the idea that technology is in the air and there's a sense that this is coming around the corner is not only accepted generally, but it's accepted by business leaders. What I want to do now is to focus on the issues of elder care. I'd recommend a wonderful book just published by Paul Osterman called Who Will Care for Us? And I've actually just been looking at a paper by Heidi, Hartmann, and Jeff Hayes called The Growing Need for Home Care Workers, an IWPR. It's actually published by the Gerontological Society of America. Both provide lots of very useful information about this labor market. Osterman argues that the shortage of home health care workers is due to low pay, poor working conditions, disrespect, and the restriction of tasks that aides can perform. Heidi and Jeff's data echo that of Paul Osterman. Home health aides are overwhelmingly women, disproportionately minority, low paid, and susceptible to high turnover. For me, the simplest thing that we could do right now, right away, is to make as many of these jobs full-time as possible. You have lots of not only low-paid people, but they're struggling to get enough hours. They often find a second job to complement the first job because their first employer won't provide enough hours. Full-time employment would come with benefits that would make a tremendous amount of difference. So I think that we can not only invest more in home health workers, but do so in such a way that we're going to save a lot of money. It's much cheaper to take care of people at home. People want to stay at home. Elders want to stay at home. Aging in place is a high priority for elders. And so simple, sensible policies of investment in higher pay, better working conditions, more investment in skills, and a broader range of tasks for home health care workers would improve the quality of care as well as save a lot of money in our health care budget. I put this slide together the other day, and I've decided that I'm not being quite fair to Osterman. Osterman says almost nothing about technology. What he does say is that he doesn't feel that technology is going to solve the shortage of healthcare, of home health aides, and I agree with him there. I'm going to take it a step further and argue that the technological change is not going to result in less work, but it's actually going to result in more work for home health care, for home health aides. My argument basically is that technology is going to facilitate aging in place. This is going to shift work from expensive institutional settings to lower cost home-based services. Technology is not going to replace home health aides in the short run, at least, but I think in all likelihood is going to increase the demand for home health workers, not just aides, but occupational therapists and visiting nurses, and it's also going to increase the burden on family caregivers. Again, it's kind of a little bit offset by the fact that some of the tasks are going to be more automated than they have been in the past. But given that elders I think are going to be spending more time at home, the duration during which family caregivers are responsible for providing care for their elders is going to be extended, and in that sense, I think there's going to be more work for family care providers. So my punchline policy-wise, I want to try to document some of the assertions I've just made, but policy-wise, I basically say home care is a much less expensive setting for providing care than institutional settings. Technology really should not be viewed in this particular case. Maybe other cases there will be replacement of workers, but in this case it seems to me that most technologies are going to complement rather than replace workers. And that technology combined with a better paid, better skilled home care labor force with lower turnover can improve the quality of life for our elders while simultaneously reducing costs. I find myself in the curious position of being an optimist, or at least I feel that there's optimistic potential. Whether we're going to fully realize that by wise public policy remains to be seen, but I really don't see this as a kind of disaster unemployment scenario going forward. I see this as an area where we're going to continue to face significant labor shortages, but if we act wisely and improve the quality of work, maybe we can make a dent in those shortages at the same time that technology is improving the quality of life for elders. I have a bunch of slides basically showing that there's going to be a growing elderly population. We kind of have some time constraints, so I think we just take it for granted that the elderly population is going to grow. There are actually some interesting debates among demographers about how much, whether life expectancy is already baked in or is going to continue to grow, but let's set that aside for the moment. And simply note the fact that, as Ariane mentioned, the Bureau of Labor Statistics is not predicting disaster for the labor market going forward, but a slight growth over the next decade. And among the fastest growing occupations are home health aides and personal aides. A number of the healthcare fields are among the most rapidly growing. Many of these are female-dominated occupations. In terms of raw numbers, we're talking about a lot of workers, a lot of people, a lot of breadwinners for their families, and a lot of significant contributors to the economic well-being of their families. We have over 2 million people who give their occupation as personal care aides, almost another million as home health aides, medical assistants, physical therapists. These are significant areas of employment. Unfortunately, so here we have a list of fields. We got home health aides near the top, along with personal care aides. Now we go to wages, and unfortunately the pyramid is reversed, and so they're now at the bottom in terms of the income ladder. Again, I suspect that many of you are familiar with that pattern, even if you don't know the exact statistics. Aging in place is something that elders place a high priority on. I think you can argue about whether it's more fun to be in a community of continuing care retirement community as opposed to staying in your house and perhaps being isolated sometimes and so forth. But elders place a high priority on aging in place. And to the extent that we can delay the things that are responsible for people ending up in the hospital or nursing homes or in skilled nursing facilities, the factors that contribute to enabling people to age in place, I think, are going to be significant. So I should apologize for the title of the talk. It's called Taking Care, Will the Robots Take Care of Grandma? Well, first of all, I'm not just taking care of grandma. There are some elderly men as well as elderly women. Not all women in their 90s have children or grandchildren. So we're talking about elders in general and not just grandma. Second of all, I'm really not talking about robots per se. I'm talking about a wide range of technologies. A lot of people, when they are trying to figure out what the technological future is going to be, one impulse is just to count the number of robots. And my sense is the technology is kind of seeping into many aspects of our lives, and robots are, industrial robots are really just one small piece of a much broader puzzle. So Japan is a place where there's been a lot of emphasis on robots. So we have basically robotic seals that are kind of companions for the elderly in Japan. There are some robots that are trying to be developed that can help move elders around who have physical mobility limitations. But let me start with a broader set of technologies. And I'm not going to start with healthcare per se, but more home-based technologies. We'll kind of get to healthcare in a little bit. So smart homes, I think, are going to facilitate elders staying at home. I don't want to exaggerate here. I have an 85-year-old aunt who is kind of technologically phobic, and she kind of has trouble with her cable TV set. So not everybody's going to adopt all of these technologies tomorrow. Some of them are expensive. They're going to be phased in gradually and so on. But my sense is that 5 years from now, when you go to buy a refrigerator, the refrigerator is going to have, the first option for your refrigerator is going to have smart features built into it. So the question is, in 5 or 10 years, are people going to have refrigerators that can help make a list of what food has been purchased and hasn't been purchased, and make a list and maybe even send it automatically to Amazon or whoever it is that's providing the food, and that food might be delivered to your home? Again, is this going to be sufficient to keep somebody at home who's kind of developing serious manifestations of dementia? Well, obviously not. This isn't sufficient to keep people at home. But I think it kind of is an incremental movement in that direction. Transportation technologies. I think it's going to be quite a while before we have self-driving cars, and Ariane and I maybe have a brief discussion of whether it's the technology that's holding us back, and I'm convinced that technology is not 100% reliable at this point. But for elder care, we don't need 100% reliability. If we have kind of super cruise control that can alert people when they're about to bump into the car in front of them, that can keep them in lane, that can help them park their cars on their own. Again, if it incrementally, at the margins, makes driving a little bit safer for the elders, keeps them geographically mobile for a little bit longer, that's going to contribute to more aging in place, and that's going to contribute to an increase in demand for home health workers. Now we're going to move for a second to the kind of gee whiz technological future. I don't know if exoskeletons are going to come into being at an affordable price, and I don't know if wearable airbags are going to become important. But again, there's a whole range of technologies that are being developed that can facilitate personal mobility. The thing about exoskeletons, it's not only that you might be able to help the elders remain mobile, and of course falls are really significant in the health trajectories of the elders, but exoskeletons can also help home health aides pick up their patients and clients. And of course, back injuries are among the most significant areas of injuries for home health workers. So exoskeletons, I think, are super cool thing that's a little bit on the horizon. And the other thing that I think is super cool about exoskeletons is that it reinforces the idea that technology is there to help us. It's not to replace us. Okay, self-driving cars are kind of sold as a way of replacing drivers. Exoskeletons have no other purpose other than to help us do what it is we want to do anyway. So Again, I'm not trying to sell any of these products. I don't know if any of them work. I don't know if any of them are going to come to being. But here's a picture of a personal airbag that can keep you, if you fall, can kind of cushion the blow and can perhaps reduce the number of broken hips, broken bones. Exoskeletons, think of it as a brace that's kind of a smart brace that you can talk to, that can kind of help you with your mobility as opposed to just kind of being a heavy thing that you have to carry around. So we've been talking mostly about technologies in the home, mobility things, not directly about medical care, although exoskeletons are kind of beginning to move us into the out of the realm of the activities of daily life and into the medical realm. In the medical area specifically, before too long, again, we have sensors and monitors already available. I'm wearing my Fitbit. I've been wearing it for 6 months. I've gotten a lot out of it. I'm not saying it's going to work for everybody. But for elder care, blood pressure monitors, glucose monitors, motion detectors, smart pill dispensers, lots of little things. Individually, again, maybe none of these are going to be sufficient to make a huge difference in anybody's life and an ability to live independently, but you kind of add all these things up, and my argument is that none of these are going to be sufficient to replace home health workers. None of them are sufficient to take away the care responsibilities that family members are going to have. But each of these things, I think, kind of tips the balance slightly in the direction of aging in place as opposed to going to an institutional setting. Now, I do want to make one caveat. I'm kind of running out of time, but there are some technologies that I think make more sense in an institutional setting than they do at home. Okay? So for me, telemedicine is a case where I think it makes more sense in an institutional setting than it does at home. So imagine it's 3 in the morning on a Saturday night. The elder feels chest pains, they're disoriented, they're concerned, do I need to go to the hospital or not? If you have a nurse there and you can get a doctor on the screen and they can walk you through a couple of conditions and figure out, does this require an emergency room visit or not? That seems to me to be a technology that can, provide, give people answers when they need it, where they need it, and perhaps might also reduce some emergency room visits that are not only unnecessary, but also medically, can be medically dangerous. And when you go to the hospital, there's exposure to disease and lots of things. You can do telemedicine at home, but I think without a professional there, without guidance and without support, I'm not sure it's going to work as well in the home setting as it would in an institutional setting. Nonetheless, I do think that telemedicine is going to help move things in the direction of facilitating people staying at home. A lot of these monitors and sensors can be connected to central stations. People can monitor how the elder, especially those who are living on their own, are doing and kind of send off alarms to whoever is the closest person to help check on that person. Obviously, there's reliability issues. There are personal invasion of privacy issues. I don't have a roadmap for how this is all going to work itself out, but I do think that there's going to be increasing access to monitoring going forward. I'm just about out of time, and which is just as well because I'm not an expert on what the next medical breakthrough is. The University of Pennsylvania, they're doing amazing things with cancer. And on every medical front, whether it's diabetes or heart issues or cancer, there are medical advances. Again, my sense of this is that the sum total of all of that is going to be more people living longer and especially more people living longer in their healthy years. And again, I see that all of that as resulting in an increase in the amount of demand for home health work. The one area where I'm really not sure that there's as much happening in the way of breakthroughs is dementia. Again, maybe there are experts here who know more about what's happening there. But in any event, one last quick little point about technology. Technology, I feel, is not a continuous movement. There are discrete breakthroughs, and I feel that voice activation is a pretty important breakthrough. I've been using, computer menus and files and folders for decades, but it's a whole lot easier for a lot of people to talk to your digital assistant or what have you, and I think that that's going to connect to lots of devices and is going to be helpful for elders. All of this, I think, may require some increased training and increased familiarity with technology on the part of home health aides. But again, we'll have to see what technologies we're talking about and how that evolves over time. So to reiterate, the punchline for me, home health is a much less expensive setting. Technology, I think, is going to complement what people do as opposed to replace what people do. The fundamental contribution of technology, as I see it, is shifting care from institutional settings to the home setting. Again, at the margins, it's not going to eliminate nursing homes. It's not going to eliminate skilled nursing facilities. And we should look forward to and try to promote a future where technology combined with better paid, better skilled home care labor force with lower turnover and having machines and people work together, I think we can improve the quality of life for our elders. Thank you.
Thank you very much, Jerry, for a very stimulating and informative talk about will robots take care of grandma. My mom is 100 and half, so this is a very deep personal interest to me, and I have enjoyed this very much. It's now our turn to hear from Sarita Gupta, another good friend of mine and IWPR. She is both with the leadership of the Jobs with Justice organization and with Caring Across Generations. In both jobs, she's an organizer, she's a publicist, and she's an expert. She's an expert on the economic, labor, and political issues affecting working people, especially women and those employed in low-wage sectors. In her role with Caring Across Generations, she spearheads a national movement of families, caregivers, people with disabilities, and aging Americans working to transform the way we care in this country, a transformation, I might add, that we rather desperately need. You will often see Sarita speaking on the public media and at large national conferences, so we're especially grateful to have her here with us this morning. Thank you, Sarita.
Great, good morning. How are you? Okay, is that better? Yes, okay. It's great to be with all of you today, and thank you so much to Heidi and Ariane and the whole team at IWPR who have been incredible partners in our work at Caring Across Generations and at Jobs of Justice. And I'm really excited about this project, Ariane, that you're leading, because I feel like everywhere I go, the conversation about the future of work and robots is sheer dystopia. It's like, everything will change. We will not have jobs. People will live in dire poverty, and there's no texture to the conversation. It's these extremes, and so I really appreciate the work that you all are doing to help us get into the nuances and be in front of how we can shape what the future looks like. So thank you for that. And it's great to hear Jerry Jacobs, Professor, this was a great presentation, and frankly, so aligned with so much of what we're learning and seeing at Caring Across, which is really what I want to talk a little bit about, just building off of some of his comments. First, Heidi introduced Caring Across Generations. I just want to add a piece that our goal is to build a care infrastructure that we need in this country. So when we talk about transforming care, it really is transforming the whole system of long-term care in this country, or just the care systems. And that will require access to quality, dignified, affordable care choices for families and individuals. That includes more supports for families, recognizing the growing caregiving needs for many. And finally, that we do need millions more quality caregiving jobs with adequate training, living wages, and benefits. So that's sort of the frame from which I come to this conversation. There are a few points that the professor made about that I wanted to build upon. So one is, I love your punchline that investing in the elder care labor force combined with support for home-based technologies represents a path forward for elder care in the U.S. And I think that's absolutely spot on, and want to talk a little bit more about what we mean by that. And I agree that the advent of technology will shift work to more home-based settings and increase the demand for a home care workforce. And so now more than ever, we need to invest in this workforce. I also believe that it was really helpful to see the various examples of the kinds of technologies we're talking about, because again, due to headlines and frankly, even sci-fi movies, like when we think about technology, we do immediately go to robots and we don't think about all the technologies in between. And so I do fundamentally believe that the content of home care jobs will also shift as a result, or will be impacted by technology. And that's something for us to get in front of and think about in terms of the opportunities for training and what that could mean for career ladders and pathways. So let's just talk for a moment about the workforce. You referenced Paul Osterman's book, which is a fabulous book, and I also agree should be read. Home care workers are some of the most vulnerable workers in our nation, and I know we sort of say that, but I want to give a little texture here. They are predominantly women, large numbers being women of color and immigrants. They make poverty wages. 30% rely on public assistance programs for food security, and they lack benefits like health care, so many of them are dependent on Medicaid, for example. Caregiving is difficult, highly skilled work, and it really is about time that we valued such work. This work, when paid and taking place in the home, has been devalued throughout our history, and largely because of its association with the work of Black women. This is a legacy of slavery that we need to understand. This is a workforce that has lacked basic labor protections because of a New Deal era compromise that left out domestic workers and agricultural workers. So we are still dealing with that legacy. This workforce is low on the totem pole, as you saw on one of the slides there, in relation to the other health professions. It's on the one hand morally unconscionable that people we rely on to take care of our loved ones can't take care of their own families, right? They are also mothers and daughters and sisters, and they cannot take care of their own families. And I have to tell you, a few weeks ago, I met a home care worker who said to me she had to leave her job, which she loved, because staying meant that she was hurting her own family. And that is just wrong, right? This is work where you have to have a passion and a real desire to care. And I meet so many women who leave this field that they love and they're passionate about for jobs in retail or fast food because the pay is actually better in retail and fast food than in home care. Again, this is wrong. So if you're not persuaded on moral grounds, it simply does not make any practical sense. Workers cannot provide quality care if they can't even care for themselves. So again, some of the turnover, the low retention rates, the worker shortages are all proof that we have to improve these jobs. So given that, we talk about home care jobs as the jobs of the future. So a few things I want to talk about around the role of technology in particular. That it's really important. There's many aspects where technology can make really good sense in supporting the quality of the work. So whether it's helping in repetitive tasks or where there's undue physical burdens, or helping in tracking or managing tasks, so that we could more fairly value the high-skilled, emotional, analytical, complex aspects of the job. You need a person to make the technology work, so the content of the work may shift as well. If we invested in making home care jobs good jobs and understood the role that technology can play in this context, this could help older adults on so many levels, not just aging adults who are in need of supports and services, but actually the home care workforce themselves, because home care workers themselves tend to be older. More than half, 53%, are 45 years or older. So if you could imagine Hoyer lifts and lifting technology, that is helpful to an aging workforce as well, right? And as Jerry stated, the range of new technologies may gradually lead elders to demand aides who are conversant with monitors, sensors, smart homes, and other technologies. So training will be essential in the workforce. Using technology to deliver training is something we need to be thinking about. And I know there are people out there thinking about apps that can be used to help train the workforce and other such ways in which technology can be supportive of training. This may also help us establish career pathways within this field that can create more opportunities for growth and development. We know that the digital technology is already more important for elder care workers than it was 10 years ago. And so, there's an opportunity here for us to think about with more training and more skills in this arena, how can we build better rewards? How can we build career pathways? And then this piece about medical communication, one thing I want to say is we've been in a lot of conversations with health professionals who say, how do we fill the gap of communication? You have a home care worker who may be working daily with somebody, there is an emergency, or their general practitioner who needs information. There's a real gap right now in how the understanding of home care aides is then translated or shared with health professionals in other arenas of health. And so there's ways we can think about how technology can bridge some of those gaps. I know I'm at time, so I'm going to say a couple more quick points, and then we'll get into conversation here. So I think thinking of technology expansively is going to be really important. Another is safety. A big issue for home care workers is safety and sexual harassment on the job. Technology may help to increase efforts to tackle sexual harassment on the job, much like we're hearing about hotel workers who now have panic buttons. Like, what kinds of technologies can be put in place to help ensure safety of home care workers? And certainly scheduling technology. There's a lot of conversations happening about the opportunity to address scheduling issues. Can we imagine scheduling firms to help ensure equitable hours of work that are distributed to the workforce, whether that's full-time or part-time work? And I agree, I think we want to push to full-time, but there are some workers who want part-time, and so how do we accommodate that? So in general, I think the premise is correct. And so the last thing I'll say is the shifting work to home-based settings, we should not just run past. It is true that 90% of Americans prefer to age in home, and that's a preference that we know people have. We also know the cost piece is huge. It is so unaffordable right now for families to figure out any kind of affordable care options. So just to say that the cost of childcare and elder care are out of reach for most American families at the exact same time when the needs are growing. So 70% of our workforce makes less than $50,000 a year. Average child care costs are $25,000 a year, and nursing home costs between $80,000 to $100,000 a year. It just does not add up. So the costs are enormous. And I say that because in the next 5 years, according to BLS, 50% of our workforce will be caring for elders in some way or another. And we do not have the supports in place to actually address that. And so The idea of investing in our workforce is important in understanding the role of technology, but it cannot be thought about in a silo. It has to be connected to a much bigger picture of how are we redesigning our care system as a whole in this moment, and really investing in the kind of infrastructure that we need. So I'll leave off by sharing an exciting example, because I think states are on the front lines of having to really manage this issue, what it has been a growing crisis in many states. And so I think states are on the front lines with coming up with policy solutions and figuring out how we can both grow and strengthen the workforce and find supports for families and affordable care options. So one state that I want to lift up is Maine. In Maine, the Maine People's Alliance in Caring Across Generations is advancing a ballot initiative for a universal home care, to establish universal access to home care supports and services for more than 10,000 seniors and Mainers with disabilities. The passage of this ballot initiative will allow families and individuals to have affordable access to care. And this proposal would create a dedicated funding stream of about $100 million through a payroll tax increase and sort of closing a tax loophole in the state, essentially. And what we did is we said, okay, we are proposing we create this dedicated funding stream. It goes to a trust. We have a board that oversees this trust, and this board is comprised of home care workers and industry representatives, as well as families who are utilizing this benefit. And the point I'm making here is the promise of this is to make sure, it was the point that Ariane made, of making sure that the people who are actually doing this work are actually in the driver's seat of shaping what the delivery system of a universal home care program in Maine could look like, which we need to be thinking a lot about, is how do we ensure that the voices and understanding that home care workers have are shaping our future. So I'll leave it at that. I'm excited about what the future holds, but it requires us to not be passive players, but active in shaping that future. Thank you.
Thank you very much, Sarita, for those insights. We're going to invite our panel to step up on the stage. Jerry, Ariane is our leader for this section, and she has a care story from this morning. Of course you're coming on stage.
So anybody who has questions, please shoot them at us. We won't be chucked out of this room at 10, but we, of course, understand if you need to go. And if you have a question, please say where your name and what organization you're from, if you're from an organization. Thanks.
And we have some Mike Rovers right here. Question.
My name is Sonia Michelle from the University of Maryland. I just want to question the basic assumption here, which is that home care is more expensive than institutional care, or cheaper than institutional care. And the question is, if you include sort of hidden costs, like the fact that you might have to pay rent or a higher mortgage on a home that's big enough to accommodate an extra generation and perhaps even a living caregiver. If you count in the unpaid work of family members who are taking care of the person who's at home and possibly foregoing their own employment in order to do that, if you add in food costs and all sorts of other things, doesn't it end up being more expensive than institutional care? I mean, I would think that institutional care could be, would realize benefits of efficiencies of, when you have one person taking care of more people and so forth. So I just wondered if you could spell that out.
Do you want to take this? That's a great question. When people talk about, and you're making me think about lots of things that are kind of built into the assumptions. When people talk about it costing less, they're talking about public expenditures being less. And you're absolutely right. I mean, aides have to run around cities, and one of the big issues is transportation challenges, buses, and other kind of public transportation doesn't always work on time, that they have to have their own cars, and they don't know paid enough to support their cars. So I think you're raising a really big fundamental question about the cost structure. For me, the factor that dominates is the fact that elders want to age in place, and so we should be able to provide that if we want to. But you've given us some good questions to think about in terms of the real total costs, not just the public costs of home care.
Hi, I'm Judy Levy from the DC Coalition on Long-Term Care here in the district. We have a crisis right now. We're finding that many of providers cannot even recruit aides to work. And I'm talking about nursing homes, home care, assisted living. Many of the younger population that goes into the job leaves. The turnover has actually increased now over the years. For a while, it had plateaued. And so certainly technology is a positive movement, but you have a crisis right now, and I don't see government recognizing or doing anything about it. Do you have any recommendations?
Yeah, I mean, I think that's precisely why we're saying we have to create a demand for an investment in this workforce. I mean, the reason for the the high turnover is because the jobs are so poor quality. And so really making that demand in states, in local communities, matter. I mentioned the main example. A big theory of that is that then we have money that we can put into the workforce in terms of recruitment, retention, better wages, training opportunities. And I think across the country in states, that's what we're certainly anchoring our campaigns to do more of that. You're absolutely right. We're not going to get out of that without understanding as a country that we need to value care and caregiving jobs. And that's fundamentally, this has been invisible work. And frankly, if 50% of the US workforce is going to be grappling with these questions of care, and there's currently 20 million of us who are in the sandwich generation, there's a lot of work to be done to stop making that need and that pain we're feeling invisible and private, and actually bring it out into the public sphere to really push for the kind of investments that we need in this workforce.
I would also point out that if 70% are earning $50,000 or less, there's obviously no way to improve the situation without a greater public investment. That's right. So it's public revenues and public taxes. And you get a lot from your taxes. One of the stories that Bob Kuttner tells that I like from American Prospect is if you brought your car to a mechanic and he said to you, "Oh, I'm sorry, I can't fix it," you'd be really TO'd. And that's what's happening with their government. And that's why we're seeing strikes in state after state of teachers, because the parents want their kids educated. They don't want the schools to say, "Oh, sorry, we can't educate them." So we have to say the same thing about elder care. "Oh, sorry, we can't do elder care." In Japan, elder care is guaranteed to every elder. And they have enormous elder care services. And they're doing the same in Hawaii, where a family can get $80 a day toward elder care in order to allow an adult to go to work. And this has been passed. It's called the Kapuna program. So organizing is a very effective way, and we would like to add policy research that backs up the demands that organizers make is a very effective way to bring about change as well.
And then maybe we can take the last. I think there seem to be 3 questions. If we can take them together, and then that's the last.
First thing is, when you were talking about the, Michael, engineering background here. The first thing is you're talking about the age-old conundrum of the definition of GNP. If I were paid to care for my neighbor's parents, and they were if I paid them to care for my parents, both of us would be counted in the GMP. But if I care for mine and they care for theirs, It's not in the GNP. So that's, I mean, it's something that's well known. It's not an exception, but nobody actually knows how in fact to value these things which are contributed. I mean, leave it at that. I mean, it's an age-old problem. It's been true ever since GNP was defined. But you said something, at least I hadn't read about before, but it struck me as interesting. I always had thought the institutional care would be more expensive than home care. But imagine if, automation, in an institutional setting, you can pay to put wires and networks and all kinds of things. You could pay for really complicated robots that could actually lift up somebody and put them into a bathtub. I mean, the kind of things you couldn't afford to install in a home, and you would have to have people to do. So is it possible in the long run that it might be cheaper to rather than, less expensive than having a dozen humans going around and lifting people up and doing stuff like that, that you could reserve humans for the human kind of stuff, and in an institutional setting, it might actually be cost effective to have, it might take $1 million robot to get somebody in and out of a bathtub.
Great, thanks. Let's take the other two questions.
Hi, Shirley Adelstein from the Urban Institute. So clearly, one of the big recruitment challenges is the poor job quality in the field, but another is that men don't want to do these jobs in large part because of job quality, but certainly not just because of that. Care work is seen as women's work, and if half of our population is unwilling to consider it and we don't have systems in place to encourage men to consider it, that seems like a long-term challenge too, and I'd love to hear your thoughts on that.
Was there one more?
No.
Shall we go? We can maybe
we'll go
just
down
go
the panel.
this way.
Let me first respond to the one about men and caregiving. It's very important to get more men in caregiving, especially the way it's organized now. They're bigger and they can lift bigger people. Probably with the proper training, a smaller person can lift a big person too, but it's probably also often useful to have, on average, larger person, stronger person physically. And it's actually a rapidly growing area of elder care. The men in elder care are growing faster than the number of women in elder care. They're still quite a minority, but I think it is becoming attractive to men, partly because those are the jobs that are there. And so one good thing about getting men in the field is we may come to realize we have to value it more and pay it more. And on your point, I would just say that the Commerce Department has added what they call a satellite account to the GDP to take into account caregiving. But Nancy Fulbright, a noted economist of caregiving, says that the methodology is woefully undercounting, and she's working on a new count. So when Nancy's work is done, we'll have a better idea of what costs more, care at home or care in an institution. But there are trade-offs, and at different points in their lives, people are going to prefer different settings. At a certain point, many older people will feel more secure in a group setting.
On men in elder care, one of the issues is that the low-wage care market is becoming more gender diverse, and it's becoming more racially and ethnically diverse, which means really, it's like when cashiers was no longer a non-traditional occupation for women, meaning men were moving into it, you kind of think, oh my God, that, in a way is, oh God, now everybody has got really bad opportunities. So I think the key challenge is to improve those jobs and to improve them, and then to improve them for men and women. But I think at the moment, the fact that they're paid so little, you just think, why would anybody with any other options move into it, kind of. Yep.
So I've thought a lot about men's work and women's work for a long time. There are often niches within women's work that men do. So there are men nurses in emergency care rooms and on cardiac rehab floors and so on. So But I don't have any particular strategy for recruiting more men into the field without improving the quality of work. There was one other thing I wanted to pick up on, but it's skipping my mind at the moment. Anyway, I'll just pass it on.
Sure. So a couple of thoughts on the question of men. I mean, fundamentally, if we step back, we need a serious culture shift in this country of how we value care and caregiving. And I know I keep saying that. And so our campaign is all about not only advancing really important policy solutions, but fundamentally shifting culture. We have to shift the culture around care. And so when we talk to, it's interesting that you raised the question of men. So I'll just share, we've been meeting with the NFL Players Association. And football players need long-term care, many of them, because of incredible injuries that they endure during their time, and they hit retirement at like 35 or something. They have very limited options for long-term care supports. And so the Players Association is like, this is a big issue for us, and our players need male caregivers. There's opportunity in that. Like, one, what would it mean for football players to come out and talk about care and the valuing of care? But the other is to talk about the need for the care workforce to be improved and to be diversified in terms of gender. There's lots of opportunities like that. Like, this is the thing about the elder boom and the reality that so many people are needing more care right now. It really does present a whole new narrative opening around how we talk about care, how we think about this work. And so I want to encourage us to think about that. The second is the cost question. I just want to say, it is true that people in different stages of their life want different kinds of care, and the whole point here is to expand the choices for families. For some, institutional setting may make sense. For others, assisted living may make sense. Like, nursing homes versus, assisted living or independent living centers or home-based care. It all depends. Like in my family, my sister and I care for my father who has Alzheimer's, and for a long time, home-based care made sense. And then we've recognized there's an isolation that my mom, as his primary caregiver, is experiencing. We're gone for 8+ hours at work all day. We come home, and she's going crazy. And so then moving into an independent living space made more sense, where she can build community and engage with others and get supports and programming. Eventually, we are not kidding ourselves. My father has Alzheimer's. Eventually, we will need a whole different kind of institutional care. That's the point. We need to expand the choices for families, and not have it be it's either or, but all of, and how do we do the best that we can to create those affordable options moving forward.
Thank you very much. That was a perfect end, I think, to this. All the materials from today will be on our website, www.iwpr.org. And as you could see, this also was live streamed, and so that will be available as a resource. And once again, thank you so much for Morgan, for Jerry, for Sarita, to give your time and your thoughts to this event and to this very important issue. Thank you.